For the next syndrome that affects babies, which we'll be looking at, is what is known as a Beckwith-Wiedemann Syndrome. Beckwith-Wiedemann Syndrome. So for the Beckwith-Wiedemann Syndrome, these are some of the classical findings, right, for a child that is affected by the Beckwith-Wiedemann Syndrome. Macroglossia, that means the tongue is so big. Macro meaning big. Okay. Lateralized overgrowth. Okay. Then what? Umbilical hernia, ear creases. You're having too much folds in your ear. Facial nervous simplex. You understand? So it's actually a rare genetic disorder. It's characterized by overgrowth and an increased risk of what? Childhood cancers. That Beckwith-Wiedemann syndrome. So it's typically present at birth or in early infancy, and it involves a range of physical and molecular abnormalities. Okay. Macroglossia, umbilical hernia, Omphalocele. Alright. So what are the features? A person having that macroglossia, what would be the issues the person is having? So issues like what? Macrosomia, the whole body of the baby is bigger than the normal size. Right. Macroglossia, the tongue is enlarged. Hemihyperplasia, okay, that's what? Asymmetric growth of one side or part of the body. Omphalocele or hernia, so there are some abnormal defects in the walls of the body, alright, and this is causing the abdominal organs to actually come out, Visceromegaly, so the internal organs like liver, kidneys and pancreas are becoming so large. Neonatal hypoglycemia, the level of glucose in the body of the baby is actually low, ear creases or peaks. Then tumor risks, there's a risk of the baby developing cancer, right, at that stage or later on in life, see it. So genetic basis is linked to what? Alterations on chromosome 11p15.5 affecting genes that regulate growth, like the insulin-like growth factors, the H19, the CDKN1C, alright, and the KCNQ1OT1. So these genes are subject to genomic imprinting, meaning their expression depends on whether they are inherited from the mother or father. Okay. So diagnosis and management is diagnosis. You are looking at all those clinical features. You are seeing them. Big tongue should be one of the reasons. Okay, you're actually saying somebody has a Beckwith-Wiedemann. So management is if the person is having low glucose, you are replacing glucose. Surgical correction of physical issues. All right, regular screening for tumors, then genetic counseling for families. So that's it for the syndrome.